video is intended to make you understand the basic features which you need to look before using a face mask during patient care. Basically, you need to look at three parameters which is described in the packet insert which comes along with the mask. First is the fluid resistance, which is the ability of the mask to prevent penetration of any liquid material, especially blood or oral secretion. Higher the fluid resistance, higher is the protection. Second is the bacterial filtration efficiency, which is the ability of the mask to filter aerosol particles of size less than 3 microns. Third one is the particle filtration efficiency, which is more relevant to viruses, which usually form a size of about 0.1 microns along with the fluid along. So fluid resistance, bacterial filtration efficiency, and the particle filtration efficiency are the three things which you need to look at. Remaining two are not related to the contamination by the bacteria or the viruses. So what is the ideal fluid resistance? Ideal fluid resistance, especially in COVID-19, should be around 120 mmHg to 160 mmHg. Those are areas where the aerosol exposure can be moderate to high. And the particle filtration efficiency should be more than 98%, assuming that the virus comes along with additional liquid particles which does not exceed a size of 0.1 micron. So this is the mask we use in the outpatient departments, and American Society for Tests and Materials Standardization has given different level of exposure, and here it is ideal for outpatient consultation where you see the patient at a distance and the probability of the fluid spray is very less. This has a very low fluid resistance of only about 80 mmHg, but a decent particle filtration efficiency of 95%. Now, when you are exposed to a higher level, say moderate, more than light, moderate, a heavy amount of aerosol fluid spray, then you need to go for masks which have a level of 2 or level of 3. So here the fluid resistance, as you can see, is about 120 to 160 mmHg, and the particle filtration is around 98%. So this is very essential when you are working in the ward or in places like critical care where you need a higher level of protection. Now the N95 particulate respirator, as we all know, has the maximum filtration. It has the maximum fluid resistance of 160 mmHg, and it literally doesn't leave any virus possible. So the particle filtration efficiency is about close to 100%. So what you need to know is that when you use a mask, always check for these parameters before using them and be safe while carrying.